robots have come a long way. They can now help doctors perform surgeries, not just on adults, but on children too. Watch this story for more details.
This might look like an ordinary operating room at first glance. However, the surgeon conducting this procedure isn't standing by the table or even close to the patient. Instead, robotic arms are meticulously performing the intricate task of clearing an obstruction from the patient's kidney and ureter. These robotic arms handle most of the surgical work, which is directed by the lead surgeon using joystick controls. Robot-assisted surgery has been increasingly common in healthcare practices in the UK. Southampton Children's Hospital in England is leading a UK trial of the use of an advanced pioneering robot-assisted device called the Versius surgical robotic system. The new robot has advanced precision and maneuvering capability that allow it to be used on younger patients. Following a successful series of trials on adults, 7-year-old Reese is the first child in the country to be operated on with the device. Reese ended up in the hospital after a recent playground accident where tests revealed an obstruction that was blocking the flow of urine from his kidney. To address this, a procedure called laparoscopic pyeloplasty was performed. Reese's family was initially taken aback upon learning that the surgery would involve robotic assistance.
When I first heard there's going to be a robot operated on it, I was like, eh? But then obviously when you find out more that it's a doctor operating the robot and everything like that, it's just, yeah, it's a lot more understandable.
It just shows how advanced technology has come and how intricate they can get into places that aren't easy to in a normal operation.
Evan Brownlee is the surgeon who performed the procedure. The robotic arms used in this procedure have a 720-degree range of motion. This allows surgical instruments to be small enough to perform complex operations on children. Created by Cambridge-based CMR Surgical Limited, this robot-assisted device aims to achieve a level of precision beyond human capabilities. How? By utilizing tiny surgical instruments, robotic control, and a magnified high-definition display.
The robotic-assisted bit is still the same idea, a little cut on the tummy, a straight shaft of an instrument, but the instrument on the inside, instead of a straight jaw, has a full wristed motion to it. And then on the outside, instead of a straight handle, you've got something that looks more like a joystick. So it's still fully surgeon-controlled. Robotic-assisted might sound like it's automated in some way, but actually it's still surgeon-controlled.
The surgeons taking part in this pioneering trial hope to see pediatric robot-assisted surgery become common practice across the world.